Hello and welcome to Unstress. My name is Dr. Ron Ehrlich, and before I start, I would like to acknowledge the traditional custodians of the land I'm recording this podcast on, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging. And as I've often said, we have a lot to learn from our First Nations people. The way they approach conflict, for example, is to start from a position of respect, then connect with all parties. After you've done that, you then reflect, and finally, you direct. What an amazing approach to conflict, and tell me we don't have a lot to learn in our modern world from our Indigenous people. Well, today we are exploring diseases, and we have an epidemic of preventable chronic degenerative diseases. We've explored these many times. You will hear about them many times. If you've been to see your doctor, if you've been given a diagnosis, for example, of cancer, you'll be told, well, it's genetic. Genetic, that is, unless you have lung cancer, where it's now accepted that that had to do with smoking. But guess what? The genes are certainly what loads the gun, but it's our diet and our environment which pulls the trigger. And that's what we explore today. My guest today is Dr. Chris Kenobi. Chris is a physician, an ophthalmologist, a nutritional researcher, an author, a speaker, a public health advocate, and the founder of two non-profit organisations, the Ancestral Health Foundation and Cure AMD. AMD stands for Age-Related Macular Degeneration, and we'll be talking a lot about that in the podcast today. Since 2015, Chris has given scores of presentations and achieved international academic recognition for his work on the dangers of highly processed, polyunsaturated vegetable oils. You will know them as safflower, sunflower, canola, etc. His goals, as you will hear, are altruistic and humanitarian, and he accepts no compensation for his work in this field. He asks an important question, in fact, gives a compelling argument for it being the compelling question. Could the diet of our ancestors prevent, treat, and reverse most cases of practically all preventable diseases? And as you will hear, he puts it in a historical perspective. No, it's not just that we are living longer. We deal with that question in the podcast, but we do have an epidemic of preventable chronic diseases. In fact, while the medical profession congratulates itself on the wonders of modern medicine, and hey, there are indeed many wonders of modern medicine. I've been the beneficiaries of that. You will probably have been too. I would also add that it, at the same time, unwittingly presided over the worst epidemic of preventable diseases in human history. And the key word here is preventable. And in this diet plan that he presents, it's very simple, it's effective, and it allows one to eat to the heart, to your heart's content. In fact, as I say as often as the world we live in becomes more complicated, the solutions are remarkably simple, cheap, accessible, and most effectively affordable. They're sustainable as well. In fact, we argue in this podcast that perhaps it's all too simple for the medical profession. Look, Chris is the author of two fabulously well-researched books. In 2019, he wrote Ancestral Dietary Strategy to Prevent and Treat Macular Degeneration, the connection between processed foods and seed oils, obesity and chronic disease. And more recently, he has released in 2023, The Ancestral Diet Revolution, How Vegetable Oils and Processed Foods Destroy Our Health and How to Recover. I hope you enjoyed this conversation I had with Dr. Chris Kenobi. Welcome to the show, Chris.
Thanks so much, Ron. I appreciate you having me on.
Chris, I've been looking forward to this conversation for some time, particularly since your publication of your book on the Ancestral Diet Revolution. And I'm intrigued by your story clinically, professionally, maybe even personally, about your journey that brought you to the point of full-time focusing on nutrition and these foundations that you've set up. Can you just share with us a little bit about that story?
Sure. And I'll keep it short, Ron, because it could get pretty long. My interest in nutrition research really is born out of my own suffering. And that started with arthritis when I was 33 years old, way back in 1994. And it was in 2011 that my arthritis had gotten to a really severe point, mostly my knees, but also my elbows and my neck, and even my fingers and toes. And I was, and I'd seen many of my, my own colleague physicians, orthopedic surgeons, family practice docs, internal medicine, a rheumatologist, and it was always the same thing. I was given medicines. Even orthopedic surgeons gave me injections in my knees, steroids, and such. But anyway, long story short is that I came across the paleo diet back in 2011. Is what changed my whole life's course, I guess, because I started really just a limited version of a paleo diet in 2011, and that radically changed my arthritis, improved my arthritis by like 80%, literally in about 7 to 10 days. And
oh my God.
Yeah, today my arthritis, now that was back in 2011, so 12 years later or so, my arthritis is about 95% better than where it was 12 years ago, using really what I would just call an ancestral diet. That in the process of that, Ron, I guess to get to my professional life now is that I when my arthritis changed so radically with diet. The first thing I did was I read, because it was the paleo diet that was working for me at the time, I read Lauren Cordain's book, The Paleo Answer, back in 2011. And I read that book while sitting on the beach in Cabo San Lucas over a week's long vacation. And I was stunned and shocked that all of this chronic disease, that we are taught in medical school is the product of mostly aging and genetics, was really driven by diet. And but there were some things, to be fair, that I didn't agree with Lauren Cordain about. And so I kept investigating, and eventually that led me to Weston A. Price's work in 2013. And I read his book, and that now I see everything through the lens of Weston A. Price. And in 2013, late in the year, I hypothesized. It finally hit me. I'm an ophthalmologist, and so one of the diseases that we deal with commonly is age-related macular degeneration, or AMD, which is the leading cause of irreversible vision loss and blindness in people over the age of 50 worldwide. And this is a rampant disease in America and most westernized countries. But anyway, I hypothesized that year that let me back up and just say that after I understood that processed foods were driving coronary heart disease and cancer and stroke, diabetes and metabolic disease, after I understood all that, then it finally, I had that light bulb moment one day. I thought, I wonder if processed foods might be driving age-related macular degeneration. And so that question ruled a lot of my investigation outside of my own practice. I was working on that question for about a year and a half, and in early 2015, I was so convinced that hypothesis held water that I left practice to pursue that full time, and I've never really looked back. I worked with some Pacific Island ophthalmologists and one nutrition researcher in Europe, and we published a paper related to processed foods, vegetable oils particularly, and age-related macular degeneration, AMD. And I published a book. And then in about 2018, 2019, the thing that kept kept coming back to me, Ron, is that the more I looked at all of this evidence, the more I was convinced that it was seed oils, the highly polyunsaturated vegetable oils, that are the big driver of chronic disease. And that's where my life's work has been focused ever since. So about the last 4 or 5 years has been really heavily invested in this, the data, the evidence related to seed oils, high omega-6 consumption, and overweight, obesity, diabetes, metabolic disease, cancer, coronary heart disease, Alzheimer's, dementia, macular degeneration, you name it. If it's a chronic disease, the majority of these, I believe, almost all of them have some relationship to our omega-6 consumption.
Boy, there's so much there that we are going to be talking about in this conversation. And, you've listed out a whole range of conditions. And I think the key there is that depending on your genetic predisposition, that they will manifest in various ways, but the cause of these issues have a very important commonality, which we're going to talk about. But I want to come back to this one point of you in 1994, between 1994 and 2011, the number, not even including your own medical education, but the number of years of medical education that you sought the opinion of. And, there were specialists that had gone through 15, 20 years of education that have had clinical experience, and yet none of them, until you discovered the paleo diet yourself, mentioned any of this to you. I mean,
no.
What does that say about our medical profession's curiosity?
To me, it's absolutely true. I probably saw 15 MDs of various specialties in that, roughly, between 1994 and 2011, regarding my own arthritis, and never did any one of them ever mention that it could be related to diet, not once. But in their defense, I was in the same boat. I mean, I never considered it either. For the most part, I always wondered if I might be gluten sensitive, but beyond that, I really didn't have any inclination to believe that my diet had any relationship to my own arthritis. But when I looked back when I finally began to understand that processed foods, which are primarily refined flours, refined and added sugars and vegetable oils, when those are a significant part of the diet, that those are driving all of these chronic diseases. I look back at my own life, and 21 years after graduating from medical school, and I absolutely had no idea that this was true all of those years, and I never really questioned it. And I believe that probably 98, 99% or more of our colleagues are in the same boat, right? We're taught in medical school that these are all different diseases with a lot of, highly variable genetics and aging driving them. And then there's just bad luck. Right. And now that I have the benefit of having, been in this field really for 12 years, since 2011, I feel like at least I've been investigating this and full time for 8 years. I look back at this and I think that the enormous majority of this chronic disease, overweight, obesity, and chronic disease, is self-inflicted. It's driven by, I believe, mostly our processed foods. And people talk about, there's a lot of environmental issues, and it's lack of sleep and stress and EMFs and all these other things. And I'm sure some of those are true, but my belief is that the major drivers are our diet, and westernized processed foods are the big driver.
It's almost too simple, isn't it? It's just for those that have done well at high school, got into medicine, studied for years medicine. It's really difficult. It's really challenging.
Mhm.
it's almost too easy. It's not intellectually stimulating enough to say, hey, guess what? All of these diseases that you are spending your life studying could actually be resolved by this simple intervention. And it's almost like we're distracted as clinicians by the overwhelming evidence-based medicine.
Mhm.
I
Yeah,
mean,
absolutely. And there's, I think you're right. I think it is almost too simple, and I think that because of that, there are many physicians that will overlook this whole part of medicine. But that's an enormous mistake. And um, nutrition science is actually the deeper I get into it, the more complex I see that it's. There's both ways of looking at it. It can be very, very simple when you look at just the big picture, but it's also very complex because there are so many variables. And I by that I mean that with 13 vitamins, and I think we require 82 minerals and microminerals in our diet and in our bodies. And you think about and then the toxicities of things like seed oils and high omega-6 and so all of these complexities, they all come, they create a very, very complex environment, which is what has made nutrition science so difficult, is the fact that we're dealing with so many variables. So even the most, even the most intelligent people like Einstein, found this, overwhelmingly complex to deal with. Again, just because there's so many variables in these equations.
I think one of the challenges there is that we have been, I don't want to say brainwashed, but we have come to accept that the gold standard in healthcare is the randomized double-blind controlled study where you isolate one variable at a time,
Right.
which is terrific for getting a pharmaceutical product to market, but it's just not how the human body works.
Exactly. That's exactly right.
Now, listen, let's kick in here because you've mentioned seed oils a few times. And I wondered if you might just give us seed oils 101, the history, how they're made, why are they made, etc., why they're so bad about them. Let's start with the history. What are seed oils? What are they?
Okay. So it's a great question, and it's a very, very long answer, but I'll try to make this fairly short, Ron. So if you look at the history of the diet, um, as far back in history as you can, you'll find that really, for the most part, seed oils did not exist except in extremely small quantities and primarily only in certain areas, without getting into great detail here. But up through about 1865, the world had almost no seed oils. And the research that I've done suggests that 90 to 95% of the world's population up through 1865 had never seen, smelled, tasted, or touched a vegetable oil of any type. The rest of the world, so some of the world had olive oil, and some of the world had tiny amounts of coconut oil, sesame oil, palm oil, a few types of oils, safflower oil, in a few populations. But as I said, probably 5 to 10% of the population had ever had any amount of oil up through 1865. And this is when Americans introduced cottonseed oil into the food supply for the first time, was right after the American Civil War, ending in 1865. So it's probably 1866 that the first people started to consume vegetable oils. But the industrial revolutionists that were making these oils, they weren't they weren't getting much success in selling these because people had only known cottonseed oil as machine oil and lamp oil primarily. they weren't familiar with consuming any kind of oil other than possibly olive oil, which very, very few people would have ever had. They weren't familiar with this as a potential food. So the seed oil manufacturers, they began to put they first made margarine, which is a mixture of butter and cottonseed oil, and then this was not a big money maker, and so then they began to adulterate olive oil in the 1860s. For certain, in the 1870s, they were adulterating olive oil with cottonseed oil. The French made complaint in 1880 about that after we shipped something like 55,000 barrels, I believe it was, of oil to France under the name of olive oil, which they knew wasn't olive oil by the taste. And they quit importing our oils at that point for quite a long time. By 1909, soybean oil came on the market. And then after that, you have the landslide of all the rest of the oils. So today, for example, now we have soybean, corn, canola, cottonseed, rapeseed, grapeseed, sunflower, safflower, rice bran, sesame, peanut oils. Those are really what I would call the seed oils, the branch of oils that are mostly coming from seeds and beans, but mostly seeds. And so all of those oils then have just exploded in the food supply, which really began in America, and was shortly followed thereafter in the 19th century by the UK, and then kind of spreading into the rest of Europe, and then gradually to the rest of the world, with Asia being really the last to take up our type of oil consumption. And so let me give you some figures. So in 1865, seed oil consumption in the United States was 0.0 grams per person per day, or 0.00000. Yeah, it was just virtually zero, right? By 1900, seed oils was about 1.2 grams per person per day. By 1909, it had jumped to 9 grams per person per day because of soybean oil's introduction. So at that time, we just had cottonseed oil and soybean oil and a little bit of olive oil primarily. And then all these other oils came by 1960 in the US. We were consuming 19.5 grams of seed oil per person per day, or vegetable oils per person per day. And by 2010, 80.5 grams of vegetable oils per person per day. 80 grams is 720 calories. That's 32% of US caloric intake. Now, this is not corrected for losses, but if you correct for losses, even in the worst, the greatest losses, you're looking at about 24% of the food supply, roughly a fourth of the food supply in the United States is coming from these factories that are producing seed oils, right? And so with that, let me just say, because a lot of physicians will be hearing this, I guess primarily physicians, that our omega-6 consumption went from 1.1% in 1865, when we didn't have any seed oils at all, to about 2.2%, I believe it was, in 1909, to 7.8% by 1999, I believe it was, and by 2008, 11.5% or 11.8%, one of those two, by 2010, our omega-6 consumption. All right, so we had a 12-fold increase in our omega-6 that's just omega-6 linoleic acid, which is about 90% of the total omega-6 in any food supply. So we increased our omega-6 consumption, whether you look at it by percentage or by mass, about 11-fold between 1865 and 2008. Okay. And why is this problematic? Well, the main reason is because we were never meant, I don't believe, to ever consume seed oils naturally. First of all, it's a totally unnatural food with a very high omega-6 content, which I can come back to and discuss in specifics. But we accumulate these omega-6s and omega-3s in our body fat, and our cell membranes, and our inner mitochondrial membranes. And what happens is that the body fat begins to reflect the fatty acid content that is in the diet. And that happens over about a 3-year period. So whatever you've consumed over the last 3 years, roughly, will be reflected in your body fatty acid composition. And so the omega-6 then goes very high. So let me give you an example. So there was 4 ancestrally living populations. I won't go into which ones, but there was 4 of them that were in 1968, 69 that were completely ancestrally living in the Pacific Islands, studied by Ian Pryor and colleagues, and their omega-6 linoleic acid in their body fat averaged 2.84%, I believe it was, right around 2.8%, which I believe is a totally ancestral level of omega-6 in our body fat. Americans were in 1960, or 1959, we were at 9.5% omega-6 linoleic acid in our body fat on average. And in 2008, we were at 21.5% omega-6 linoleic acid. So instead of being 2.8%, we're at 21.5%. And since and we've looked at, I've looked at almost every possible adipose fatty acid analysis type study around the world done since it's been available, which is the 1950s. And since 1990, the average omega-6 linoleic acid in all the studies, I think, is it's a little over 14%. So that's where we are. We should be at under 3%. Yeah. And again, we should be under 3% on our body fat, because we should be at about 1.1% roughly in our diet. And whatever's in your diet will roughly double in your body fat if you consume that for a long period of time. I say roughly. So I've looked at a number of different ancestrally living populations, and they're all under 2% omega-6 linoleic acid. And all of these ancestrally living populations, like the Maasai of Kenya and Tanzania, like the Catawbans, like the Papua New Guineans of Tucacenta, the Ashe of Paraguay, for example, these populations, they're all under their omega-6 linoleic acid consumption in their diet is under 2%. And as I said, the body fat in those that were studied was averaged around it ranged from about 2.6% to 3.2%, averaging around 2.8% omega-6 linoleic acid. So when the omega-6 linoleic acid accumulates in your body fat, which is also reflected in your cellular membranes and in your inner mitochondrial membranes, this sets up an environment that is, number 1, pro-oxidative, number 2, pro-inflammatory, number 3, toxic through advanced lipid oxidation end products, and number 4, nutrient deficient. And number 4, nutrient deficient means that the seed oils, the vegetable oils, all of them do not contain any vitamins A, D, or K2. None of them contain any A, D, or K2. And butter, lard, and beef tallow contain vitamins A, D, and K2. Lard is not a very good source, but butter, for example, or animal fats, and beef tallow are very good sources of vitamins A, D, and K2. So not only are we, we could discuss each one of those mechanisms, but there's a lot to unpack there about those mechanisms. But basically, I call those the 4 pillars of hazard that the seed oils are driving. And so along with that, if you look at all of the different chronic diseases, for example, coronary heart disease was extraordinarily rare. It was practically unknown in the 19th century. Cancer was, once pretty rare. We can go through the details. Age-related macular degeneration essentially did not exist in the mid-19th century until, very, very few cases in the entire 19th century. Diabetes was in the United States was 0.0028%. That's in 1890. That's 2.8 per 100,000 people. Where was it in 2016? 13,000 per 100,000 people in the United States. So diabetes, for example, elevated 4,643 fold between 1890 and 2016. Metabolic syndrome was unknown in the 19th century. There was a few cases noted in, right by around 1920, and noted again in the late 1930s or early 40s, I believe it was. But today it's common, right? It's more than a third of the population in most Western countries.
I think our colleagues, some of our colleagues may argue, well, life expectancy then was, if you got to 50 or 60, you were doing well. So this is why we're seeing this uptake. This would be the common response to that assertion that these kind of processed foods are having that kind of impact. What do you say to that?
Yeah. So when I do a podcast like this, sometimes, Ron, I try to pull a few things that I think might come up, and this is one of them. So because even physicians and even epidemiologists do not seem to understand that because the average life expectancy was low in 1800 and 1900, that doesn't mean that people were dying in middle age. It was primarily because of the fact that children died very young in that era, and they do in all populations that don't have clean water, clean potable water, and do not have sewer systems, and do not have medical care at all. There's a very high child death rate. And so, for example, in the year 1800, 43.3% of the world's children died before their 5th birthday. In 1900, it wasn't much better. 36.2%, of the world's children died before their 5th birthday. Even in Sweden, which had one of the lowest levels of childhood mortality, their mortality in 1900, I think, was 22%. So 22% of children did not live to see their 5th birthday in 1900 in Sweden. If you look at, so this is the statistics I have but if people survive childhood, then they live to ripe old ages, generally speaking, like we do. And for example, this is the data on England and Wales. So in 1891, 50% of the population survived past age 52, 30% past age 66, 20% past age 73, and 5% past age 85. In 1911, in England and Wales, 64% of the population was alive past age 50, 53% past age 60, 36% past age 70, and 15% past age 80. So, right there, we could, fully answer the question about, well, people didn't get chronic diseases because they didn't live long enough. They absolutely always have, throughout all of history. If you survive past age 5, typically people would survive into their 60s, 70s, 80s, and beyond.
Yes, typical. Because it's just simple maths, isn't it? Because if you had 2 people, one at 80 and one dying at the age of 2, well, then the average life expectancy of the population is 40.
Exactly.
Or something like
right.
that.
Yeah.
So,
and if you have a family if you have a family of 3 and the father lives to age 80 and the mother to age 70, and the child dies in infancy, that population of 3, the average age of death is 50, right? And that's basically, in the United States in the 19th century, the typical family had 6 or 7 children. They could expect to lose 2 or 3 of those children before age 5.
Mm-hmm.
That would be typical.
And the other side,
4% would die in childbirth. 4% of the women died in childbirth.
Yeah. Thank you for outlining that, Chris. I've never heard it put quite as succinctly and analytically as that. And I think that's a really important message. And the other side of that, of course, is that type 2 diabetes, for example, used to be called late onset diabetes. Well, we had to drop that term because now kids are getting it.
Right. Right.
So,
Yeah.
you know,
When I was in, I graduated from medical school in 1990, and I don't think that there was any children or anybody under 18 really that ever had diabetes back in that era. Now it's a common condition in childhood, right?
And you've mentioned the history of the seed oils, and you've mentioned omega-6. I love that 4 pillars of hazard: oxidative, inflammatory, toxic, and nutrient deficiency. Wow, that is beautifully outlined there. The common denominator, it should be reminding our listener too, is in all of the diseases, depending on how your genes express those diseases, the common denominator is chronic inflammation.
Yes. Well, and I would say that the oxidation, Ron, to me is I think it's far more important than the inflammation.
Interesting.
And it's a much more difficult concept, the oxidation, but when you accumulate unsaturated fats in your body, which we should not, those unsaturated fats, because of the double bonds, they're a setup for oxidation. And the reason that they are is because we have something like, well, first of all, the free radicals, which are really hydroxyl radicals, singlet oxygen, superoxide radicals, and hydrogen peroxide. Those are all of those collectively will react with unsaturated fats to produce an unsaturated lipid hydroperoxide. And those will break down then into the advanced lipid oxidation end products like 4-hydroxynonenal, 4-H&E, malondialdehyde, MDA, carboxyethylpyrrole, acrolein, and there's literally hundreds of others. And all of these advanced lipid oxidation end products, they're collectively known to be cytotoxic, genotoxic, mutagenic, carcinogenic, thrombogenic, obesogenic, diabetogenic. They're driving all of these conditions. Now, let me go back to so that's kind of the toxic part of it. The oxidation part of it, though, is very similar when you fill up your membranes, whether it's cell membranes, intermitochondrial membranes, with unsaturated fats. One of the things that's happening there is that, and this is an exceedingly difficult concept to explain in words, but one of the things that happens there is this is damaging to the inner mitochondrial membrane, which is exactly where the electron transport chain is taking place. And that inner mitochondrial membrane is critically important that it be secure and able to retain a hydrogen proton gradient. And when you fill up that membrane with unsaturated fats, and those unsaturated fats then oxidize, you create pores in that inner mitochondrial membrane that allows the hydrogen protons to leak out. And that membrane then, when it becomes leaky, you lose the ability for the electron transport chain to produce ATP, number one, because those hydrogen protons are actually what fuel the production, the transformation of ADP to ATP. And in the same process, when you lose those hydrogen protons, you also produce reactive oxygen species. And at the cellular level, the first thing the very next thing that happens in this scenario, Ron, is that the cell becomes insulin resistant. And the cell becomes insulin resistant, I say, because of lack of a better way to understand it, that the cell is sick in this scenario. And to me, the cell is putting up the stop signs saying, I'm sick, I can't handle any more food. Don't send any glucose or any fatty acids, anything into this cell, into this cell, because my electron transport chain is shutting down, right? my cellular energy production is shutting down. And but anyway, so the cell becomes insulin resistant in this scenario, and this is known. And I always say that the cell is really just a microcosm of the entire body, right? And so the entire body then becomes insulin resistant. I mean, we talk about it at the level of the liver and at the adipose and then the muscle, but it starts with, in my view, it's driven, primarily by high omega-6 consumption. Now, I'm not saying that's the only driver, but I think it is the major driver of this. Now, there are other things that can also drive insulin resistance, and these are almost any kind of nutrient deficiency can also add to insulin resistance. For example, lack of magnesium, thiamine deficiency, vitamin C deficiency, increased cortisol, which might be driven by leaky gut, any kind of inflammation. All of these things contribute to insulin resistance. But the thing that I have to go back to is that all of these populations, if I gave you examples like, Americans in 1890 that had, 2.8 per 100,000 people that were diabetic, we know insulin resistance practically did not exist. And the thing that also did not exist was seed oils. We had less than or about 1 gram of seed oils for the previous 35 years in the food supply in 1890, right? And, as the seed oils increased, right along with that, tracking precisely with that increase in seed oils and omega-6 consumption we see metabolic syndrome and diabetes go through the roof. And so did cancer, and so did coronary heart disease. Yep. They all run together.
And to remind our listener who were hearing about you identifying oxidation as being the problem, many people would know that that's why antioxidants are now considered such an important, perhaps supplement, but certainly always has been a nutrient. Antioxidants like vitamin C is a good example, an antioxidant to combat oxidative stress. I mean, just going back to 101 there to ground our listener. And the other thing interesting to hear you focus so much on the mitochondria and the electron transport chain. There's a whole story there, isn't there, Chris? Because, I'm just coming into the world of quantum biology and a lot's going on in that space. But mitochondria, and specifically ATP, are where energy is produced. So many conditions now are being seen as metabolic conditions, problems with mitochondrial function rather than genetic, isn't it? There's a kind of a little bit of a tension going on between, no, cancer's a genetic disease, it's just bad luck, and others would say, no, actually, cancer is a metabolic disease. It's a problem with production of energy to keep our body systems going.
Yes. And I absolutely believe that cancer is a metabolic disease. That's where it begins. It doesn't begin with the genetic mutations. It begins with the metabolic dysfunction. And when you lose cellular energy production, cellular housekeeping goes down the tubes. And so I think what follows eventually is the mutations. And the more that I learn about cancer, the more I see that, even a single cancer that, like, if you diagnosed a patient with breast cancer and you say, well, she has a single type of cancer, but really that individual would have, if you analyzed all the different cells, you would find that there are myriad different kinds of genetic mutations in that single individual, right? And why is that? It's because, as I said, it's a metabolic disease that's driving the downstream effects of which are all these mutations. And so I'll go back and mention here, since we're on the topic of cancer for a moment, Ron, that in the United States, cancer took the lives of 1 in 188 people in 1811. That was in Boston, Massachusetts. The town of Boston, it was a population of about 30,000 people at the time. But physicians have been well acquainted with cancer for millennia. But anyway, so 1 in 188 people died in the U.S., or at least in Boston, in 1811 of cancer. That's about 0.5%. In 1900, 1 in 17 people in the U.S. died of cancer. That's 5.8%. In 2010, it's about 1 in 3 people died of cancer. That's around 30. It was around 32.1%, I believe, is the number.
Wow.
So how do we go from 1 in 188 in 1811 to nearly 1 in 3 dying of cancer in a period of 200 years? And the thing that's changed is processed foods. And again, the processed foods are sugar, refined flours, and vegetable oils. And so I think that my view is that the vegetable oils are responsible for about 90% of obesity. And I honestly believe it's 98, 99% or more the cause of diabetes and metabolic syndrome is high omega-6 in the diet, is my belief system. I absolutely believe that the refined sugars and refined flours are adding to this problem because of the fact that they're nutrient deficient. And just as you mentioned a little while ago, the antioxidant vitamins like vitamin E and vitamin C, well, we should be getting those from sources, that like, whole grain flours, for example, could be rich in vitamin E. And sugar is a nutrient deficient food. And so this is a contributor to the whole problem. So, but, in 1865, I'm trying to remember the exact number, but it was something like 2 or 3 or 4% of the diet was processed food, really, and that was just sugar. I'm sorry, I can't remember the exact number, but in the United States by 2010, 63% of the American diet is made up of refined flours, refined sugar, vegetable oils, and trans fat. Right, and so that's the problem right there. Big picture, it's that. It's just that the evidence that I've been digging up for the last 8 years really is that I just keep seeing over and over that it's the seed oils that are the major driver.
Yeah. And I mean, going back to your journey from 1994 to 2011 and visiting all of those practitioners, the vast majority of cancer research and treatment focuses on the genetic approach to cancer. And as you've observed, even within a woman with, or anybody with breast cancer or prostate cancer, for a man, if you took a sample of that cancer, there would be a myriad of genetic profiles within that one cancer in that one person. So it's,
exactly.
We do have our own genetic profile in our cells in a normal situation, but part of cancer is millions of mutations within the one person. So how do you target millions? Anyway, that's a whole story.
Well, I want to answer that just real quick, if I could.
Yeah.
I want to say that there is, and I've now become very good friends with Dr. Azra Raza, who is an oncologist in New York, and a very well-known oncologist. But anyway, now that I've read her book called The First Cell, which is about where cancer is coming from, even she would completely agree with me that there's only one way to deal with this epidemic of cancer, and that's to prevent it. We're never going to solve this cancer problem by trying to treat cancers that have already developed. And the improvement in patients' lives in the last 50 years of cancer treatments is almost nil. We've increased the survival about 2 months in the last 50 years across the board with major cancers. With all of this, chemotherapy, radiation, and surgery, right? So we have to prevent it, and the only way to prevent it is through healthy food.
Gee, though, Chris, with the trajectory of public health messages coming out from professional organisations, governments, media and all that about avoid saturated fat and use seed oils as an alternative. And you've identified the 4 pillars of hazard: oxidation, inflammation, toxicity, and nutrient deficiency. Are you optimistic about the trajectory we're on as a society?
No, I'm not optimistic. No, unfortunately. But you know, but I do know, for example, that we've reached a few million people with this message. Have we changed a few million lives? I hope so. I don't really know, but there's only one way to change this, and that's, I think, I believe, you know, we have to do this through science. If we don't do it through science, convince people through the science like we're talking about today, we're never going to get anywhere. And so but I think we need to change. We need to change physicians. We need to change the scientific landscape, and we need to change the public. And all of those coming together. If physicians don't change, their patients will force them to change one day. They'll come to them and say, "Doctor, you don't know this? You don't know that these vegetable oils are dangerous," or something like that. You know, and I think that will force physicians to reconsider their positions and start to take notice of the fact that we have no education in nutrition in our medical schools for the most part, and what we do get is probably wrong.
Well, I would add one extra thing to your call for it being science-based, and that is to remind our listener and any physician listening to this that when we're talking about science, we're not just talking about the study of pathology and pharmacology. We're talking about the study of anatomy, biochemistry, physiology, histology, you know, the basic sciences about how the body works and goes wrong.
Right. Exactly.
Yeah. But listen, let's move on, because you have focused on 2 foundations, one focused on macular degeneration, which you've mentioned, and the other on ancestral diets, which I have to say is music to our ears. But macular degeneration, let's start with that. And you mentioned it earlier on, and tell us what macular degeneration is. What can go wrong? What is it? How common is it?
Okay, so the macula is the central retina. It's responsible for approximately the central 10 degrees of vision. And macular degeneration is, just as the name implies, is a degeneration of that part of the retina, the most important part of the retina, which is where all the work is being done to process the central vision. So the macula sees people's faces, it sees what we're reading, it sees stop signs, allows you to drive, read, see your children and grandchildren's faces, and all those kind of things. So if the macula degenerates, you will lose to some degree that central vision. And so this disease, what I found, Ron, was when I, back in 2013, when I first, the question came to me that, could it be that processed foods are driving macular degeneration? I had to know, was macular degeneration once rare? Because it needed to be rare if this is a disease of processed foods, because I knew I had some evidence even back in 2013 that there wasn't a lot of processed food in the world in the mid 19th century, for example. And so what I found was that between 1851, when macular degeneration was first discoverable, because of the invention of the ophthalmoscope, and 1930, so about an 80-year period, there was no more than about 50 cases of macular degeneration, AMD, in all the world's literature. Wow. No more than about 50 cases. Well,
so this was between 1851 and
1930.
1930.
Yeah, no more
this is
than
when
about
people
50.
were looking. This is when they had a device to actually diagnose whether it was there or not.
And they were looking. They absolutely were. Yeah, there was a horde of ophthalmoscopes developed in that period. By 1914, I believe it was, there was 200 models this is different, brands and models in use around the world. Mm-hmm. The ophthalmoscope was in use in every continent by the 1860s. Mm-hmm. And but anyway, yeah. So
the foundation for this observation is laid down.
Yeah,
I have a feeling it's a very sad story we're about to hear, but go on.
Yes. So I'll just get to the end since we're short on time. But
we're not short on time, Chris.
Okay,
there's no time restraint on this at all.
Oh, okay. So by 2020, it was estimated that 196 million people have macular degeneration. By 2040, that's expected to grow to 288 million people with macular degeneration, and already by 2004, I believe it was, the World Health Organization had determined that 14 million people in the world had severe vision loss and or blindness bilaterally due to AMD. So again, we went from no more than 50 cases in an 80-year period to 196 million people affected by 2020. And, by 2004, 14 million people in the world, with very, very poor vision in both eyes due to macular degeneration. It's a very sad story. And of course, along with that, the whole world has followed really the United States example, and they're consuming really what I consider our foods, our processed foods. And so it's just again, and all the other diseases have come with it. Mm-hmm. Coronary heart disease, strokes, cancer, diabetes, metabolic disease, it all runs together. So that it's just to me, it's just astonishing, Ron. The more I would look at all of these conditions, how they were once all medical rarities for the most part.
And how in today's modern science, modern medicine world, how is macular degeneration treated?
Well, okay, so if it's the dry type there's essentially two kinds of macular degeneration, a dry form and a wet form. And the dry form is the most common form. I think I think it's roughly 80% of the population, or 80% of the affected have the dry form, and I think around 15% to 20% eventually will develop the wet form. But the wet form is certainly more threatening. The dry form, it's treated. Allopathic ophthalmology would treat the dry form with vitamin supplements. That's it. For the most part, that's been the mainstay of treatment for most all of our ophthalmology history. And the wet form then was treated with anti-VEGF drugs, the anti-vascular endothelial growth factor inhibitor drugs, which help to prevent the growth of the vessels that grow underneath the retina when there's a break in Bruch's membrane. But anyway, it's those vessels that they break and bleed. They leak fluid or break and bleed, and therefore they can rapidly damage and destroy the macula, and therefore lead to a central scotoma, a central blind spot.
But Chris, did I hear you right? The dry form is the most common, 80%, and traditionally, did I hear this correctly, mm-hmm. vitamin therapy was used?
Mm-hmm. Still is.
Wow. Tell me what vitamins we're talking about.
So the AREDS formula vitamins are really the mainstay, and that's the age-related eye disease study vitamins. And so that's just vitamins EC, beta-carotene, zinc, and copper. That's it. And there's I don't think there's really any benefit to those. In fact, I think they could be considered harmful.
Really?
I would suggest that they would be do more harm than good. Overall.
Okay. Yeah. Interesting. Okay. Yeah. So I'm guessing that really treatment isn't really that great for this degenerative disease. I think that's the bottom line.
Right.
Yeah.
Right.
So just because we're using vitamins doesn't mean it's the right thing to do for the. Why do you think that's bad? What is it? You mentioned those then doing more harm than good.
Mm-hmm. Do you mean mechanistically what's going on?
Well, I would have thought, vitamins, they're going to enrich the flow of circulation, detox the area, regenerate. The vitamins have that kind of association with them. I'm just intrigued that
Yeah.
it's doing more harm than good.
Well, it would, purely be, speculation on my part to say, Ron, because I don't know the exact mechanisms, but I would speculate that it's the wrong way to get them. In fact, for the most part, I don't think that supplements are the way to go with vitamins or minerals. Either one.
Mm-hmm.
I think that they best need to come through a whole food matrix. So minerals are very, very poorly absorbed through when given in an inorganic matrix. In other words, when given in a supplement type form, right? And vitamins, that's a complex topic, but I think there's dangers in giving large amounts of single vitamins that really don't reflect what would be in the food, for example. So, like if you were to get vitamin E in food, right? You have 4 different kinds of tocopherols and 4 different kinds of tocotrienols, right? So you have 8 different forms of vitamin E that you would get through a natural food. But when given in a supplement, they give 1 alpha tocopherol, right? And so this alpha tocopherol then could compete with the other tocopherols and the other tocotrienols, perhaps. There's something wrong with this, though, because obviously, these supplements, the only reason that they ever gave macular degeneration patients this group of supplements was because this is primarily what was being used to try to prevent heart disease, was vitamins E, C, beta carotene, zinc, and copper. I think was it was roughly the same things, and so they just followed in their footsteps, and tried to use this for macular degeneration.
Well, I think this is a perfect segue into the discussion about your other foundation, the Ancestral Health Foundation, and you've mentioned ancestral diets, and I'm really interested. I agree with you, re the supplements, and I'm reminded of one podcast we did with Professor Fred Provenza, who wrote a wonderful book called Nourishment, and he made the point that even the humble strawberry has 5,000 active components, most of which we don't know what they do, but there's something about nature's laboratory that has put them all there for a reason.
Yeah.
And your point about the 4 different or 8 different forms of vitamin E. Tell us a bit about the Ancestral Health Foundation and the ancestral diet.
Well, first of all, the Ancestral Health Foundation is a nonprofit organization that we developed, started, and so I work for 2 foundations, that one and Cure AMD Foundation, which relates to age-related macular degeneration. But these are nonprofit organizations, and our goal with these organizations really is to do research and to spread the message about ancestral diets. And so what are ancestral diets? Well, they're the diets of our ancestors, and it does, and we all have obviously different from different countries and different continents. We have very different diets, but these different diets, as Weston Price showed in the 1930s, they all have some commonalities. And to me, I think it's easiest to review what these diets don't have, and they don't have that ancestral diets don't have added sugar in significant amounts. Certainly, they don't have refined flours, and they don't have any vegetable oils or trans fats. And so, whether those diets are, mostly fish and rice and vegetables like the traditional Japanese diet, or whether the diet is, primarily sweet potatoes like the Papua New Guineans of Tukasinta, or whether the diet is milk, meat, and blood of the cattle they herd, like the Maasai of Kenya and Tanzania, or whether the diet is coconut, fish, starchy tubers, and fruit, like the Tokalauans traditional diet. All of these diets share one thing in common. They're all from nature's laboratory, essentially. They're natural foods, first of all, that exist in nature, and they're not processed, right? And they're all low in omega-6. We'll come back to that, right? And so Weston Price found that the native traditional diets contained 10 times more fat-soluble vitamins, that's A, D, and K2 primarily, 4 times more water-soluble vitamins, that's all the B vitamins and C, and 1.5 to 60 times more minerals than did the American diets of his day, which was the 1930s. So right there, we just, we can understand that native traditional diets are nutrient-dense diets. They're rich in vitamins and minerals. And this is what we constantly overlook. It's, it's like being a football player or a basketball player or whatever, your coaches will say fundamentals, 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 right? And this is what we have to get back to with our diets if we want to be healthy, is we need to go back to the fundamentals. And the fundamentals are ancestral diets. And they don't have to be your own ancestors' diet. If if I'm an American, but if I want to eat like a 19th century American, it works. But if I want to eat like a 19th century Japanese from Japan, that also works. Or if I want to eat like a South Pacific Islander, that will also work for me. Because those diets all share the fact that they're nutrient dense and they eliminate the nutrient deficient and toxic foods.
Yeah. Well, Chris, that's just a wonderful note for us to finish on, because I was going to ask you, maybe you would add a few tips to our listeners, because they're listening to this and they're thinking that. I think you've just outlined really that. But actually, one question I will ask you finishing, taking our step back from, we're all on a health journey together in this modern world, and taking a step back from your role in foundations as a doctor, just as an individual, what do you think the biggest challenge is for us as individuals on that health journey?
You mean the biggest challenge for us personally?
As individuals. Yeah, personally, as individuals.
It's interesting. That's a great question. And I'm not sure I really know the answer, Ron, but I'll tell you that as individuals, I think that my experience tells me that the majority of people, even if they understand this knowledge, they're not willing to change their diet to remain healthy. I think they just don't realize how dangerous, what they're doing is, that they're playing Russian roulette with their diet and their health. But I would say that 85% of the population is not really willing to go to any significant lengths to change their diet typically. And that's a sad fact, and we need to change that. But so that speaks to the fact that, it would be best if we could change our food supply, and get rid of the vegetable oils, for example. But I don't see that ever happening.
Chris, thank you so much for today. I've been so looking forward to this conversation, as I know we both have, and we will of course have links to both these wonderful foundations that you are such an integral part of. Thank you so much for today.
Ron, can I mention one thing?
Sure.
So the latest book I have is called The Ancestral Diet Revolution.
Absolutely. Now we should actually let's just stop there for a moment, because I do want to. I have that in my list of questions.
Well, this is
and I did want to mention that too, because that's your latest book. I know you wrote a book in 2019, Ancestral Dietary Strategy to Prevent and Treat Macular Degeneration.
Right.
But your latest book, The Ancestral Diet Revolution, tell us about that.
Well, yeah. So the Ancestral Diet Revolution is our latest book. Just came out a few months ago, and it's all about everything we're talking about. Focuses on the dangers of seed oils and processed foods, and we have over 80 graphs in that book and about 40 tables. This is the huge majority of this book is original work. We'll publish a lot of this evidence in scientific papers, but it's in the book now. And I would encourage people to get this book. And this is a shameless plug for the book, but
that's okay.
But I want to say that I don't profit from this book. Neither Suzanne Alexander, who's my co-author on this, neither of us profit from this book. The royalties from the book go to these nonprofit organizations that we work for, which we also don't accept any compensation from. So we're volunteers, and we do this because we believe in this mission, and we feel like we're on the right trajectory to help people and to change lives and to prevent chronic disease. And so we just ask that our listeners, whoever they are, viewers, that they give this some attention, and if they believe in this, spread this message. You never know, the life you save may be your own or your family members.
Well, that's a wonderful note to finish on, and totally support that. And we will have links to that book and your foundations, Chris, on this website. And thank you for all of the work you are doing.
Thank you so much, Ron. It's been a pleasure. I really appreciate it.
Well, there was just so much in that podcast worth going back and listening to, making notes. And also, I would suggest, importantly, to get Chris's book, The Ancestral Diet Revolution, and a lot of what he talked about there was just a taster of the many pearls that he has in that book. But, the focus on omega-6 fatty acids, which we hear about, omega-3 is anti-inflammatory, omega-6 is pro-inflammatory, and in nature, there is a balance between inflammation and anti-inflammatory processes. The process of living in the world creates free radicals, and the more polluted and unnatural that world is, the higher the rate of free radicals that occur, radical oxygen species. And that is why it's often said that we need antioxidants to help deal with those free radicals. And when our diet is predominantly omega-6, our diet is predominantly inflammatory. But I love Chris's 4 pillars of hazard, because it's not just the inflammation, it's the oxidative stress that these oils cause. Yes, the inflammation as well. They are toxic. He talked about them being mutagenic and hemogenic and a whole lot of other toxic processes that go on, but they are also nutrient deficient. So that's really important. And what an amazing statistic about macular degeneration. Between 1851, when the instruments became available to assess macular degeneration, so this isn't, we never looked at macular degeneration in the late 19th and early 20th century. Not true. Between 1851 and 1930, there were a total of 55 cases. By 2020, there were 196 million cases in that year alone. So something serious is going on here. And when you hear your doctors say there's no evidence to support X, Y, or Z, particularly when it comes to nutritional medicine, I think it would be fairer for that doctor to say, I haven't read the evidence, but it's there. And it's there in Chris's books in spades. So I would suggest you read that book, join his foundations, particularly the Ancestral Health Foundation, if you don't have macular degeneration. And if you do, or you know somebody who does, I'm sure that would be another foundation to choose. We'll have links to those foundations, to Chris's book, in the website. I would encourage you to join our subscription model on the podcast. We've got some great additional resources for that, where we curate over 400 podcasts that I've done, or join our Unstress Health membership where we dive even further into these health issues and create a wonderful and supportive community. I hope this finds you all well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.